What we're going to be doing tonight is talking about decisions facing our state lawmakers, and particularly decisions around Medicaid and surrounding Medicaid, and a lot of the proposals to fundamentally restructure Medicaid, what it is and what it does. Medicaid is the program that provides support services to Missouri's most vulnerable, our working poor, our seniors, our neighbors with disabilities. To start us off, I'm actually going to ask Reverend Tim Carson to come up.
That's really good. You're doing it already. We want to set, I also represent Faith Voices of Columbia, and our mission is to pursue issues of justice with a broad coalition of faithful voices in the community. So that's why I'm here. So the statistics and our experience are now bearing out that we live in one of the most divided and polarized times in our nation's history. Why it is that we believe something is important and precious and essential and crucial. And so the question is, where are these voices? Thank you.
I'm going to talk about proposed budget cuts that were offered by Governor Wright in his budget. And I'm going to focus on a particular area, home and community-based services. These are programs that care for our neighbors that are seniors, neighbors that are people with disabilities. And it's where a large percent of the budget cuts that Governor Wright has proposed come from. First, the governor has proposed a 3% rate cut across the board for Medicaid, fund services like nursing home care for people that can't afford to pay it out of pocket, or in-home care for people with disabilities, many other programs. This 3% cut, will go to the providers of those services. It is expected that they will simply make up the difference internally without any cuts to services. Second, there is a proposed 60% cap on what would be paid for a program called consumer-directed services. Consumer-directed services is a program that allow people to stay in their homes and have a home care worker come and assist them with things that they might need. Estimates are that in changing the criteria on this test, 20,000 people in this state would lose access to services. It's not about whether or not they have improved and are different. It's about making it harder to actually qualify for the services. I'm now going to ask Teresa to come up and tell a story of one of her friends who's not able to be here, I believe works in one of these programs.
In 1962, my grandfather opened an auto parts store in a small Missouri town named Louisiana. It is a classic American dream story that brought him success. My father went on to run that business up until the time he sold it in 2016. For years, he worked a blue-collar job and provided the best for my mom, brother, and I in a small town. He came home many days with blackened hands from difficult work. My mother, Judy, was a middle school teacher until she became a middle school counselor. She went on to earn 2 master's degrees and teach at Missouri Baptist College in St. Louis. She also earned her LPC and was a court mediator. Needless to say, she was an amazing overachiever. In October of 2010, my mother, at the young age of 56, suffered an autoimmune brain damage from an extremely rare disorder. This disease left her mind intact, but not her body. She required a high level of medical care. Due to the stress of the situation, within 2 years, my father suffered a massive stroke, leaving him severely disabled as well. With the help of a caregiver, at almost $4,000 a month out of pocket, they were able to stay in their home. After 6 years, they were unable to sustain that expense. They went through all of their savings and retirement and were forced to declare bankruptcy. They lost everything. On April 14th, 2016, I moved my parents into Lakeside Meadows Nursing Home. They moved into a skilled medical setting. It was awful for them. Lakeside itself is an amazing and beautiful facility, but my parents were young and shouldn't have been in such a restrictive environment, usually reserved for those in the last stages of life. After 7 months, I was able to convince the nursing home to allow them to move into a residential care apartment. It gave my parents a small apartment that somewhat resembled a home. They have medicines provided along with food, housekeeping, and laundry. They are able to maintain some independence. Lakeside still agrees that this is the most appropriate placement for my parents. There are some issues that I want to bring awareness to, and I'm asking for your help in changing. When my parents were on the level 1 skilled side, with the help of Medicaid and Medicare programs, they were required to pay $3,000 out of pocket. When my parents moved into level 2, those benefits were cut off. Now, she didn't mention this in this letter, but I recall that those benefits being paid at level 1 were over $8,000. So the amount of money that the state is giving them now is about $292 a month. When my parents moved out into level 2, those benefits were cut off. Medicaid and Medicare offered no assistance to individuals who need residential or assisted care living. They applied for the Missouri Cash Grant offered through Missouri Health Net. My father, due to his lower income, qualified. My mother, because she makes a modest teacher retirement, was denied. With state budget cuts proposed for Missouri Health Net, we fear my father will lose this small benefit and it will be taken from others like him. It makes no sense to force people into more restrictive environments under the false pretense that the state will save money by cutting programs. The state will actually pay more for services that are more restrictive than they would by allowing them to be in residential or assisted care programs. My parents are at risk because they can only afford the $3,000 they've been asked to pay. However, now they will be responsible for over $4,000 a month in rent. Medicaid and Medicare should fund assisted living and residential care programs to help seniors stay independently in their own homes. My parents should have been able to stay in their own home with assistance from the state. It actually costs millions of dollars less because there are people in skilled care that we're paying for that shouldn't be there. If a person qualified for help on one side of the building, they shouldn't be denied help on the other side. It's been said that 20,000 people will fall into this gap if the budget cuts and changes to qualifying for Medicare are made. Can you help me voice this injustice and help protect the program that will allow my mother and others like her the $292 a month that the Missouri Cash Grant offers and guarantee that my father's benefits don't disappear? They would hand these over directly to Lakeside each month just to pay their rent. Now, I've sent this letter to several of our representatives, and it might have even crossed your desk. The Trosts were hardworking people, and their capacity to give was without measure. I know that we have structures in place to support our elderly and disabled when necessary. And as a fiscal conservative, I think it seems in the state's best interest to provide an avenue to use money wisely. Allowing people to access the minimum care to allow them to live as close to normal seems as though it would be beneficial, both financially and perhaps morally. The cost savings in this one case seems to make it worthwhile. The denial for me is hard to justify, particularly if the Trosts would continue to qualify for more intensive and subsequently more expensive care. So tonight, I would ask that you work to ensure that our most vulnerable friends can continue to access the care that they need.
We're having to cut $500 million out of the budget this year. I understand people are struggling, I really do. I understand that this is a difficult economic time for people, but in general, let's just talk in generalities real quick. Unemployment has ticked down in the state of Missouri pretty consistently since the economic downturn, since we started the recovery. Wages have ticked up in the state of Missouri about on average what they are nationally at this point. We aren't necessarily in an economic downturn. We're on an increase, right? We're still on an upward trajectory in the economy when you look at numbers. this isn't the time when you should be having to cut $500 million out of your budget. The reason why we're doing it is because of special interest tax cuts for corporations over and over have been passed. Corporate tax collection this year is down 26%. Personal income tax, individual income tax collection is right on par with where it was supposed to be. We're all still paying the same amount. Sales tax collection is right on par with where we projected it would be. Again, corporate tax collection is down 26%. We're balancing the budgets on the backs of seniors, people with disabilities, and students. Those are the three sectors that took the biggest hit. That's where we're making these cuts. And we talked about the level of care rising from 21 to 27, significant cuts in in-home and nursing home care. Last week, we were provided the false choice to restore this funding. And I say it's a false choice because we're going to potentially restore this funding to in-home and nursing home care in the state budget, but we're going to do so by rolling back the circuit breaker tax credit for low-income seniors. That was the false choice that we were given, was that, okay, well, if you want to fund in-home and nursing home care, then you're going to take away an average of $530 from over 100,000 Missouri seniors. That is literally $530 on average out of their pocket. Democrats stood up on the House floor, had multiple amendments filed. One that would delay implementation of Senate Bill 509, a massive tax cut passed in 2014. And this wouldn't stop the tax cut, it would just delay implementation. This is the first year, this will be the first year of the phase, and in 2018, that's $90 million out of the budget in the first year of phase, and that's a 5-year phase, and it's going to be over $600 million out of the budget once it's fully phased in. We also had another amendment to roll back some of the corporate tax collections, to actually make sure that corporations are paying their fair share, to make sure that seniors aren't having to pay additional money. And both of those amendments were ruled out of order. They weren't allowed to come up for a vote. Now, something that hasn't been discussed tonight, but you're going to hear start moving forward soon, a bill that we're hearing in Budget Committee that we'll vote out as soon as we get back from spring break, and that's House Bill 1110. And House Bill 1110 rolls back the prescription drug program for Missouri seniors at 85 to 185% of the federal poverty level. These are the people in the donut hole. These are the people in Medicare Part D donut hole. They receive an average of $290 a year to help them pay for prescriptions. This is 64,000 Missouri seniors. And there's a lot of overlap with the same 100,000 people that are going to be paying more in taxes each year when we roll back the circuit breaker tax credit. So people need to realize what is going on, because it is atrocious. It makes me sick to my stomach, and it is morally reprehensible. It really is. It is remarkable that we are purposely asking less of corporations, but balancing it on the backs of seniors who are going to be paying a significant more. So I thank you for allowing me to rant for a minute.
But I share the frustrations of my colleague Kim Kendrick about what's going on down there. It is atrocious. You know, everything that Kip said about the budget is absolutely true, and that the decisions that have been made in the past legislative sessions have resulted into where we are right now. When we were having the debate about the circuit breaker tax credit, that was a false choice. One Republican said, well, this is what we have to do. These are the cards that we've been dealt. No, these are the cards that they have dealt themselves, and now we're in a mess because of decisions that they made. And like Kip said, it's going to be on the backs of seniors and low-income folks. For people that don't know much about my background, I'm a social worker. I've been doing that for the past 10 years, and most of the work that I've done has been in programming that allows low-income seniors and adults with disabilities to remain in our communities through different programming, including in-home care. So I have seen that firsthand, how important it is for folks to be able to remain in their homes, have a good quality of life, and be immersed in communities. So that's something that I care a great deal about, and I know that we are going to fight very hard on those budget cuts. I also want to say on the tax credit, the circuit breaker tax credit that Kim was talking about, It barely passed the House. It is on its way to the Senate. I urge all of you to contact Senator Caleb Rowden, who is our senator in Cooper and Boone County, and demand that he not support it and that he vote no against it. I think that that's an action that you should all be taking because he needs to hear from his constituents. I think it's vitally important. And lastly, I'll just say, you know, we're in the super minority. It is tough to be in a body that is passing such terrible legislation that really impacts the most vulnerable in our state. And so the policies and these issues are never going to change until the players change. So I urge all of you to also be very involved in local elections.
And I want to thank you all for coming out tonight. The last thing any of us want to do is sit here on a Wednesday night and talk about policy. It's great to talk about the things we care about, but when it gets down to the wonky bits, I start to gaze over, and I printed out the Senate bill that is proposed, which is Senate Bill 28. And I was like, this is just almost impossible, and I just kept on reading about it. I'm not going to say too much about it. It's just that it's about block grants and how we take money from the federal government. And we're changing it from a solution that fits the needs of Missouri to a solution that's one size fits all. And from a state that's so invested in personal rights, so invested in state rights, I don't understand how any senator could be proposing this bill and hurting the health care of Missourians. I've lived with my children under the point system that was talked about earlier, and I know how much changes can affect your health care on a state level. And I'm really excited that we have a couple of healthcare professionals here tonight to talk to us about it. I think they're going to give us a really great idea of how it specifically affects healthcare and give you some talking points to call Caleb Rowden and talk to him about why this is not right for Missouri. I'm going to bring up Kristen Bickman-Wilson. She is the VP of Health Services at Planned Parenthood, and she's also a nurse practitioner. Thank you so much for being here.
One of you can use your voice to the best of your ability to contact your representatives. None of this is passed. So remember that when you leave today, that you all have assignments to do tomorrow. Okay? Pick up the phone, call again, send an email, tell your friends, send them the phone number. Make it as easy as possible for them to reach out to their representatives and declare their dismay in the conduct that is happening this year. I represent Planned Parenthood. If you don't know us, we have been way too long, 100 years to be exact. And what I want to tell you is that we have planned contingency plans, desperation plans for what could happen to our patients should bills like Senate Bill 28 pass that make Medicaid a block grant. And so let's just say if you got a pizza and this was your grant for that year. Let's make it as easy as we can. This is the size of the pizza that you're going to get. Economic things shift and change day to day, month to month, week to week in your state. But that pie will not change. The amount of money that you're getting on that block grant is not going to change. You may have to put more people in there, but they will all get less. Okay? So the understanding that a block grant is going to allow the state more flexibility is true. But the flexibility is in the fact that should we have the need to add more people because of an economic downturn, the services they will actually be providing could get smaller. Or they change what it requires you to qualify for that, which is how we see that happening in our near future, which is why Missouri was not a Medicaid expansion state, right? Because that gap that was in there that was going to cover the working poor did not grow. In fact, the number of people that were still uninsured in the state of Missouri is what? 300,000 people, I think, that are still not covered because we didn't do that. Medicaid currently covers 900,000 in the state of Missouri, and this is men, women, families. But I will tell you, in my research done over women, it's typically 75% of Medicaid are female. So don't tell me this is not a women's issue. This is a women's issue. This is women and their family qualifying for services that they should be able to get. So I'm going to step back from my moral high ground and give you dollars. Because the state should care about this. If you don't think unintended pregnancy is not a health care issue or is not a funding issue, you're crazy. This is crazy. Unintended pregnancy costs our state millions of dollars. Every dollar we spend to prevent pregnancy cost the state $7. And that's just an initial cost. That's not free or reduced lunches. That's not cab fares or Medicaid services because they don't qualify or work in an employment situation where they get their own insurance. This trickles down for 18 to 19 years for each pregnancy. This is a financial issue. This is a public health crisis. Under Obamacare, where you could receive a higher access to birth control, that number of unattended pregnancy around the nation dropped drastically. Why is that? It's not rocket science. It's because people could prevent it. And this is what we need to believe in. So prevention is not just unintended pregnancy, it's prevention of cancer. It's early diagnosis of diabetes, hypertension, anxiety, depression. Those are all covered under Medicaid services. And why would it seem to you that somebody who has been diagnosed with cancer can't go see an oncologist? They're the expert in cancer. They can get Medicaid. My Medicaid patients wouldn't have access to an expert in reproductive health care because they would not see me as such. But I would argue that we are. We've been around 100 years. We are the experts in reproductive health. We know what we do. People call us and ask us what to do. We are the experts. But you would be denied access to an expert in reproductive health care should Planned Parenthood be funded under Medicaid services. One other thing I want to hit pretty hard is this whole defunding nomenclature. Make no mistake about it. We don't receive a block of money that just is a check written to Planned Parenthood, we get it every year, here's so much money you get to spend. No, we are reimbursed for services provided like any other healthcare professional. We qualify to be a provider. They look through every credential I have to make sure I'm good enough, I'm educated enough, I have enough experience to care for my patients, and we get approved just like everyone else. If we're an approved provider for Medicaid services, why should my patients not be able to choose me if this healthcare bill makes it so much more flexible for choice? Because I would argue my patients would choose me. So, make no mistake about it, this is a serious issue for Planned Parenthood. We are passionate about Medicaid services for our patients and the access to health care they have. You know, many of our clinics, and I serve around 4 states, have a large number of Medicaid patients within their system. It would be detrimental to our affiliate to lose Medicaid. I'm not going to lie. But even though it may hurt us, it's going to hurt the state more. You will still pay for them. You will still pay for these patients. If you take Medicaid away and their access to preventative care, you will pay for them later when they are more sick and they are in urgent care, or they have the unintended pregnancy that results in a pregnancy delivery or high-risk delivery, and that baby ends up in an NICU because they received no prenatal care. So make no mistake about that. You will still pay for health care services for the most vulnerable in the state because they will seek it, whether they can pay for it or not. It would make more sense, as someone that's been in health care for a while, to pay for preventative care because it's least expensive. You provide more education. It's not in a hospital setting. And these patients live longer, participate in education, participate in the workforce because they're healthier adults and they have healthier families. So I want to remind you again that you all have an assignment tomorrow because this is not passed and people need to know that we care and that it's important for us to speak out for maybe those that are less fortunate and more vulnerable that don't speak on their own behalf. I'd be happy to take questions should anything else arise.
Oh, hi, thank you for coming tonight to hear us. So everything I've read about block granting Medicaid from various experts says what was just said, which is that most likely we'll have a reduced number of people on Medicaid and services that they receive will most likely be reduced under any block grant system. Now, although gaining health insurance doesn't guarantee you're going to get access to health care, it's absolutely a guarantee that if you don't have health insurance, you will have barriers to health care. I've been at Family Health Center for 20 years. I'm the medical director. I've had a lot of experience with uninsured patients. Most of my patients, or not most, a lot of my patients are uninsured. Most personal bankruptcies in the United States are a result of medical bills. stories. I'll give you one quick story. A guy who had his own business cleaning houses, got a kidney stone that got stuck, and it just wouldn't pass, and he was in a lot of pain, and he had blood in his urine every day. And I had to prescribe some pain medicine for him, and he had no health insurance. And this went on for 2 to 3 months. He was out of work for 2 to 3 months. Finally, I mean, it was lucky for him in some ways, in a lot of ways. It was when the Affordable Care Act first came out, and he signed up for it. And within weeks of getting affordable health care coverage, Affordable Health Care Act coverage, Obamacare coverage, he got his kidney stone removed. He went to a urologist, and the kidney stone was removed. He got off his pain medicine, he went back to work. But lots of success stories like that. I have patients who've had heart attacks who couldn't get cardiac rehab after their heart attack because they had no health insurance. Patients who've had injuries and can't get physical therapy. People who have severe obstructive sleep apnea and can't get CPAP machines. So we're a safety net provider, and the safety net clinics, our clinic, family, Planned Parenthood, other community health centers in the state, or 20-something community health centers in the state, I think we do good work, and we do the best we can, but it's limited, and politicians are fond of saying, no, politicians, present company accepted. All the politicians are fond of saying that people can get health care, all they have to do is go to the emergency room. And that's just not true. I mean, if you've ever been sick, that's just not true. Emergency rooms don't provide primary care, they don't provide preventative care. They do a great job of saving lives. If you have a heart attack, you should be in an emergency room. But they don't do anything for preventing the heart. I believe that we have a moral imperative to help our neighbors, and that should be enough to correct this. But if the moral imperative is not enough, there are plenty of economic reasons to fix this. When people without health insurance get sick enough, they do end up eventually going to the hospital and the emergency room. And lots of studies show that the care is more expensive in the emergency room. It's more expensive in hospitals. So from a fiscal standpoint, we can justify expanding health insurance coverage. All of us are paying for this. If people, unless we're going to have a country where we're going to say emergency rooms can turn people away, which right now the law says that they cannot, luckily, we're all going to end up paying for it anyways. And so we're just ending up paying more expensive care instead of preventative care. So it's really morally wrong and economically short-sighted to go back to the days before the Affordable Care Act. We should be working on expanding Medicaid, not decreasing it. The block grant is a way of decreasing Medicaid, and we should be looking at further expanding Medicaid. What we really should be doing is Medicare for all.
A budget is a moral document, elections matter, and there are real-life consequences to the decisions that are made down there.
House Committee Bill 3 was what I was talking about, the circuit breaker tax credit. And House Bill 3 is different. House Bill 3 is funding for higher education in the state of Missouri, but House Committee Bill 3 rolls back the circuit breaker tax credit, and then it puts it into a fund that would go towards the in-home and nursing home services. So it's cutting from seniors to give to seniors. And again, I have major concerns with that. Democrats had, well, again, we had 2 amendments that would have added the appropriate funding and done so in a humane way.
Briefly describe the circuit breaker for folks.
Yeah. So the House Committee Bill 3 rolls back the renter's portion of circuit breaker tax credit. So if you're a low-income senior making less than $27,000 a year, you can qualify for a circuit breaker tax credit that basically is a refund at the end of your year, that you can receive back a check from the state. And that it was put into place to help keep low-income seniors in the homes and in the rented homes. So we're rolling this back for the renters portion, which you could make a strong argument that the seniors renting their homes are probably in a worse position than the seniors owning their home. Both are in a difficult position if they're just making $27,000 a year. I understand that on fixed income it's a concern, but the renters portion is particularly concerning.
Yeah, and just to kind of elaborate on some of that. So for the tax breaker credit, for the circuit breaker tax credit, as a state, we give away $700 million in tax credits every year, and the fact that we're starting with a vulnerable population, that's what we're gonna look at and pick apart and take away for vulnerable Missourians. I think that that's an important note to make. And then just to go back a little bit on some of the stuff about the block grants, I think, not supportive of the block grants for all the reasons that you guys described. But another thing is, another consequence if we did go to a block grant style is that we couldn't get additional federal funding. I mean, it's like a cap, this is what you have. And so if we had a natural disaster like the tornado in Joplin, we wouldn't be able to access federal funds to help relieve situations like that. So I think that's an important factor too for people to keep in mind. And just very briefly, I want to thank Dr. Quinn and Kristen for all the work that you guys do and that you provide for folks like that. Medicaid expansion, we are one of 19 states that have not opted into it. What's going on the federal level, it's hard to know really what's going to happen. But before I ran for office, I actually was an advocate for Medicaid expansion, and I know how critical it is for the working poor to be able to access health care and to be healthy workers. It's an economic issue, but also just support their families. And so we have definitely missed out, and we would have had budget relief in our Missouri budget. States that expanded Medicaid and took those federal dollars had budget relief. And I think that that's also an important point to make when we're looking at the budget crisis that we're in right now.
Well, obviously a lot of it depends on what happens at the federal level at this point. That being said, I can't imagine if Medicaid expansion continues to be part of federal law. I can't imagine that we continue to pass this over for many more years. I mean, it's just it's morally reprehensible to use that again. It is that, but then also fiscally, it's fiscally irresponsible as well. I mean, if you're fiscal conservative, you can obviously look to neighbors in Kentucky, where in the first year of Medicaid expansion, it was a $1.2 billion economic impact for their state, over 12,000 jobs created, most of them in the healthcare industry. And we're starting to see pushback from quietly and somewhat publicly from Republican governors who in states who have expanded Medicaid saying, you guys can't take that away from us. That's hundreds of thousands of their citizens that would be left without coverage, and then also the damage that it would do to their hospitals. The damage that we've done to Missouri hospitals it blows my mind. It really is just, I feel like I don't know what the reality is anymore sometimes. I really don't. It's purely politics above people and above what is right for the state.
We've had 3 rural hospitals close. So what does that mean for people, even if they have insurance? They're going to have to travel how far? When people are responding to people that are having heart attacks or an accident on a farm, I mean, those are real life situations, and it's going to impact the outcomes for them in life or death. And then also, not just from, having a hospital in your community so you can age in place. You can age in the community you want to retire in and live in. That's a factor as well. But also the economic part of it. So, there was a hospital that closed a couple of years ago in outside of Springfield, and I'm sorry I'm blanking on the name of it. It employed 100 people. It was the largest employer for that community. So, the repercussions are felt, for people losing their jobs. That probably through their jobs they had health insurance. Those are things that we have to look at, all the collateral damage that comes out of these decisions that are made.
This is something that hits home to me, yes, literally in some aspects. I grew up in rural Missouri. I grew up in a small town, Monroe City. It's northeast of here. And, it's a town of 2,700 people. And they have been hit significantly and without necessarily realizing it, with a lack of Medicaid expansion in their community. And then just going back real quick to the circuit breaker tax credit, and if we do see movement on the House Bill 1110 that I was mentioning, the rollback of the prescription drug plan helping low-income seniors, that's over $800, like I said, over $800 out of seniors with fixed incomes out of their pockets each year. And the problem is that you're going to put these seniors in a position where they're spending down their savings and they're spending down their assets in such a way that makes them Medicaid eligible. And all of a sudden, they're dual eligible for Medicare and Medicaid. And I don't want anybody to take this the wrong way. That is a very, very, very expensive population. And by providing the $300 a year on average that we do for prescription drug benefits to help them access these drugs, we're able to actually keep them from qualifying for Medicaid. We're actually helping them take their medications regularly, stay healthy. Without this, they're going to spend down their savings, and they're going to be in the hospital, they're going to be more unhealthy, and they're going to be eligible for Medicaid. And it is going to cost the state a lot of money, a lot more money than what it does currently. And we just, so short-sighted, we don't see that. Or people just don't care. I don't know. Either way, it's wrong.
We did invite Senator Rowden to come tonight. He did indicate in a previous commitment, but it is our duty to call him and tell him to vote against this bill and to urge others to do it. It is our duty, as Kristen said, this is our job. This is our one job as people, is to tell our legislators what we need to do.
It's been a long session. It's grueling. It's really tough waking up each and every day knowing that you're headed to Jeff City to be beaten. And we're just in a position where we don't win any of the battles that we're fighting currently. That's not to say that Martha and I don't fight hard each and every day, because that's who we are. It's been an honor so far to work alongside Martha. She's very bright. She's got a great future ahead of her in this arena. And we've got a dedicated group down there, but we are such a super minority, one might say, that we're ineffective. We need more, and we need you to be engaged in such a way that not only is calling to push back against House Committee Bill 3 and House Bill 1110 and Senate Bill 28 and all these bad pieces of legislation. We need for you to be engaged in helping us recruit good candidates and helping us get people elected that represent the values of Missourians and not just the interest of a few. We need help down there. We really do. We're not going to give up. That's not who we are. We're going to keep fighting each and every day. And thank you for the support that you provide us here in the community. It makes our jobs a little bit easier, I promise. Thank you.
Yeah, I would also echo what Kip said. It's a hard fight down there, but I'm so proud of the Democrats that offer amendments and speak up in committee and speak up and fight bills on the House floor, because I think that we have a very strong moral compass. And I've only been down there for a couple of months, but I am so proud to represent the 46th district and progressive values, and we're going to continue to fight. So thank you.
But it's a job, and they do work for us. And there are representatives that are not here tonight to listen to us. And we were told, well, if I want to hear from the people, they can come and talk to me about it. 2 hours on a Wednesday night talking about policy matters. Writing letters to the editor about issues that are important to you matter. Talking to your friends and your coworkers matter. We can do it. I know that we are stronger together, and together we will do this. So thank you for coming, every single one of you. And please let us know how we can help you, because that is what we are here to do. That's what all of these organizations are here to do. I know that. We are all going to be here ready to talk to you about what we can do to help advocate for you. And again, thank you so much for being our face.